Like 10 years ago, my brother had a traumatic brain injury in Colombia, South America, and he stayed in the hospital for almost 4 months. It was a very sad experience for all of the members of my family, especially because in South America there are not too many rehabilitation centers for people with brain injury. And usually after the patient is discharged from the hospital, the family has to start providing service for the patient, because we don't have over there, we don't have a lot of rehabilitation centers, we don't have cognitive rehabilitation therapies, and over there, when you have a brain injury or spinal cord injury, the amount of rehabilitation service that you will receive is very minimal compared to the United States. We start doing, experimenting things, trying to make him, to walk, doing some exercise with him, doing also some, like, I would say, cognitive rehabilitation exercise. We didn't know anything about cognitive rehabilitation at that time. Also, I was doing my bachelor in psychology, and I didn't know too much about cognitive rehabilitation, but I started, practicing, doing some attention, memory exercise, and working with him, every day at home. He went back to the university, he finished his bachelor degree, and he's working right now. He's like 25 years old. Happened 10 years ago. I think if he would have been in America, probably he will have more opportunities to receive inpatient and outpatient rehabilitation services in this country. And he probably will receive occupational therapy services, speech language services, and also probably cognitive rehabilitation, because when my brother had the injury, he had a lot of memory and attention problems. In some hospital in South America or in Colombia, they try to use the same instruments or the same tests that people use here in America. And sometimes they translate these instruments and provide this instrument, and provide this evaluation using the instruments that we usually use here in America. And some of the instruments, most of the time are not culturally relevant, and the probability to make, mixed diagnosis is very big.